flag. So we'll just pass the camera around. They're telling followers there's nobody yet. So why'd you put jeans on?
Because then if you leg lock me, you can see blue and gray.
Oh, all right.
As
I could have put
opposed to us
shorts
both
on
wearing
too.
gray pants.
These look gray and these look gray.
I mean,
I'm pretty sure our sweatpants are the exact same gray.
I could have put black sweatpants on.
I think they'll put pants on.
What? No one wants to leg lock me?
I'll leg lock you. I don't really want to leg lock you. This is double ACL surgery, so. Hi guys, we're here with Jeff. We got a couple people following now. Jeff's from Pro Physical Therapy. He's here on Mondays, and today we're just going to kind of mess around with some stuff we do in Jiu-Jitsu and talk about maybe we got a fake knee, so we're going to twist that up a little bit and show what happens there with some stuff. Got Sonia, got Mike. So I'm going to heel hook Mike just so we can show everybody what happens when you perform the heel hook. And then we'll, pop, right? Yeah, no, what we'll do is we'll pop the fake one to show how that works. But so yeah. So, anyways, and if you guys have questions for Jeff at all, feel free to throw them out there. Yeah, especially jiu-jitsu related. If there's anybody that's trained, that's why we're doing it on the Alliance Jiu-Jitsu one. If you're doing any jiu-jitsu related injuries or techniques and kind of how they affect the body, if you saw the video Jeff posted last week was Sonia performing the Americana on me and just talking about how that range of motion affects dislocation and some things like that. So I'll let him explain it because he'll explain it better because he's scientific about it and I'm an idiot.
Yeah,
so.
that was kind of fun. In that case, you had a ball on a socket, so you had concave on convex. And in addition to moving up and down, that ball sometimes wants to roll forward and backwards. And when it's at 90 degrees here, like where you should be throwing a baseball or softball, it's safe because all it's doing is spinning in the joint. But if you get above and especially below, as you go back into this motion, that ball wants to pop forward. So Sonia had Mark at 90 degrees, no tap, but then she brought him a little lower and then put him in a little extra and then a little bit of this, and then it makes this ball want to pop forward and dislocate. And so it's kind of fun to relate what causes a tap, what makes the shoulder want to dislocate with when kids have a lot of shoulder pain throwing a ball, because if they get down here too much, that ball always wants to ride forward every time they throw the ball. So it relates to a lot of things with other sports in addition to jiu-jitsu.
That's cool. That's cool stuff, man. I think it's cool because, jiu-jitsu is such a, they always call boxing the sweet science. And there's a meme out there all the time. They say boxing is the sweet science and jiu-jitsu is quantum physics, because we do so many manipulations of so many parts of the body. But I think it's really cool to be able to relate it, especially with things like this little knee joint here, to really be able to see the ligaments, to be able to see the movement of what we're doing to the body. It gives you kind of two things. One, it can help your technique because you can understand how you're trying to manipulate, which I think is cool.
We're getting out of it too.
Yeah, exactly. Yeah, like what's safe to do and what's not safe to do when you're stuck in something. So let's, since there's no questions yet, people are watching again. If you guys are just joining because there's a bunch of people jumping on, if you have questions, injury related or something along the lines of joint manipulation and stuff, we can deal with that. Jeff would be happy to answer some questions for you guys. I think what we'll do is we'll start the demonstration. Who wants to get heel hooked? Do you not want to get heel hooked, or do you? It doesn't really matter to me. I'm going to heel hook Sonia for this. She's more flexible too, so it actually worked better. And then we'll look at the knee joint, and Jeff can kind of explain as we do this. So we're going to just talk about, there's a couple of different variations of the heel hook. And the reason we're showing this one, I think it's, even though the heel hook's something that, if you guys don't train a lot, it's not allowed in a lot of competitions. It's not allowed in gi for any tournament. And there's a reason for that. It's because when you see how we kind of isolate the knee, and especially with that added fabric of the gi, it's very difficult for any of the defenses to happen. And it makes probably the chance of injury much greater. It's also something that's not allowed in any of the federation tournaments, but if you watch, ADCC and some of the other bigger level no-gi tournaments, that's a very common and kind of popular move. Two things with that is, one, I think leg locks in general, it's a little bit easier to get on people's legs than it is to get onto a choke or an arm lock, and it's very damaging. The heel hook it's very effective. So I think sometimes people think because we don't train them that much that I don't like them. I think if you're not going to be a professional with jiu-jitsu, I don't think it's necessary to work that technique. I would put my emphasis in other places just because the risk of injury is so high. And as we explain this, and once like we were just kind of messing around, Jeff and I were spinning the knee around a little bit, and when we explain this, you'll see the kind of things that can happen. So usually you get caught in this position. It's almost like the 50-50 guard, right? And this is how you're going to see a lot of people get heel hooked, okay? Or you see people get it from this position. So this one, what's known as like an outside or normal heel hook, this one isn't so bad. This is when we start to do this and bring this leg over. So this would be the leg reap, right? This would be the leg reap. This would be illegal in the Federation tournaments. And because I'm already starting, I have this ankle trap, and I'm starting to put rotation on the knee. It's not that bad, right? What people will do in order to create the heel hook is I'll bring this leg over here, okay, and isolate the knee. So now the knee can't rotate. If I start the heel hook and she's able to put that knee towards the ground, she can get out, okay? But if I isolate that knee, so now she can't do that, and then I take the grip on the heel. And what's going to happen here is now I'm keeping the knee from rotating that way, but I'm basically just rotating, right, from the tib fib to the knee. Like I'm just rotating this part of the leg. And again, we'll explain that on here. And that would be it. Right. Pretty light. I'm going to go easy on this stuff. Yeah. And then what a lot of people will call the inside heel hook or the inverted heel hook, this is a better one. Because this now is even 10 times worse, right? I have the knee here. The knee is already not going to rotate out to the outside very well, right? Here. And you notice her hand comes up much faster on that one. So same thing here. I'm still rotating the knee. This one being the preferred one for a lot of guys, also more dangerous. The injury is going to happen faster. There's no real way for her to turn the knee that direction like she can in the other one. And so from this position here, for me to be able to get that and just apply a little bit of pressure to the ankle. So what we're doing is we're isolating the knee, and then we're twisting against the knee with the heel. So if you guys have seen, there's a lot of them, right? We were just talking about the Craig Jones, Vinny Michaelesh one. That was pretty awful looking. I know, was it Jao Meow that had his Apollo in ADCC? He had one that was against, one of them.
I know Lachlan Giles was tearing people apart with it.
Yeah, there's a lot of heel hooks this last ADCC. But you can see why, and you can see why people have to tap, and you see why when they don't, that they're sometimes in need of surgery. So what I'm going to do is we're going to turn over to Jeff. He can kind of use the model to maybe explain that, and if you need us as well.
Yeah, the first thing it looked like, when you see patellar dislocations in basketball, football, it seems like it's like an adolescent or pre-adolescent female thing, and it's usually they land, they rotate this way, which ends up basically being the heel hook. And what happens is, quad is still firing to try to stabilize, and the line of pull ends up being way more this way, so the kneecap ends up popping out of the socket, out of its groove, and ends up in the side of the leg. And so that happens in weight bearing. That's usually with the quad firing a lot too, but that's really what we're trying to do is make that same motion. If you pick the knee model up, like I said, and you do that same thing, you're gonna rotate either tib out this way or tib in. You can see it's gonna want to pull patella out. If you, the dangerous part of that is if you open up knee, so you have patellas, yep, and we peel that away and we bend it open. You've got ACL, and then behind that you got PCL. So ACL is the one that it resists tibia or shin moving forward. Also resists tibia being rotated this way. So if you have the heel lock and you're taking them this way, you're putting the ACL on a lot of stretch, and it goes far enough, it's going to want to pop. So between kneecap popping out of there, out of this groove, which is, like I said, you showed me the picture of the one that happened recently, or ACL being put on stretch enough to the point where it actually fails. You can usually get MCL in there too. The part that you hope doesn't happen is meniscus back here is all connected to joint caps and stuff. You twist it enough, the meniscus is going to tear too. But that's really, plain and simple, it's the same mechanism as patellar dislocations, and this is really, when you watch kids, you train kids for jumping and sprinting, you're always trying to train them out of landing like this and jumping like this, or anytime they're in single leg landing, making sure they don't have a lot of this going on. So with the heel hook, you're basically taking the things you try to coach out of kids that hurt them in ball sports and using it to tap your opponent out. So same thing but opposite. But hopefully this kind of makes it look a little bit familiar with what happens both at the knee level and other sports and things that you try to train people out of. So I guess how would you train out of that to be a little stronger at that? It usually comes down to hip strength and this kind of thing, because if you can keep your leg out of that position, and that's really external rotation. For ball sports, at least, you try to train the external rotation or hip abduction, so being strong in this motion, which prevents this going on. It's probably a little bit harder. You'd have to train the hell out of it in jiu-jitsu to get out of it, but still, if you're stronger in the movements that are the opposite of the position they're trying to put you in, it should be harder for them to get you there to submit.
A lot of the defense to that is going to be that kind of external rotation that you'll see people doing. Most of that is just them not wanting to expose the heels. So again, if we're here, kind of like when we're in the leg lock position too, if I'm going here, is that if I can get under that heel, now I have that twist. So a lot of times you get locked here, you're trying to do it, I'm trying to turn it over. See, I can't even get that because she's keeping that foot flexed and that hip rotated out. That's going to make it much more difficult for me to get under the heel. But if I'm able to somehow get this, especially a lot of times through the knee, so if I bend the knee a little bit, now she can't defend that as well. The heel starts.
Got it. And so for her to get out of it, she's going to move her body around.
If she wanted to get out of this like completely, the best thing that she can do is try to put her knee down between my legs. So what some people will do, and this is actually good because people will learn in defense, they'll try to just roll. The problem with just rolling here is as she rolls now, if you notice her knee can't get to the ground. So even though she's rolling here, I can use my body to block the knee. But if she's able to get the knee through here, so she gets up and she's able to foot now here. But now I have no EI. So even if I'm doing this here, she starts to just keep going, spin out, pull her leg out. So a lot of times you'll see that as the best. If you can get some little space and get your knee free. There's other submissions that come after that, so it's not a great,
So your knees only really move, like 99%, they only move this way and this way. So she was able to turn around so that instead of him trying to get the twist that way, which knees don't like, if you're able to get to the point where you can get this motion available again, then I guess it gets you out of it. So I guess that's the getting the knee this way, because also would have this.
Leg locks are funny because I think people look at the leg or the heel, but they hear heel hook and they're like, oh, it's the ankle. And it's like, we're really isolating the knee. And with that, the rest of the body, because the less that she can move her body so that this knee isolation keeps, the better chance I'm going to have for that. So you can see that that's,
So that's, I think, right out of knee injury prevention 101 is if you can avoid that tibial internal rotation and landing, you can see ACL was put on stretch in addition to the patella being put in a bad spot too. So
another one that's really common with knees is some of the guard passing we do with people trying to, and I think it's very similar. But let's say I'm going to use you if you want to go on your back. This knee cut pass that people try to do. So you can see what'll happen here. There's a magic to this. There's my leg lock, but a lot of times people are here and they're trying to pull their leg out and they'll lock the leg here. And so now I'm trying to do this and I end up. It's almost the same thing as a heel hook when you look, because my heel is isolated. My knee is somewhat free, but because I'm trying to go this way. And eventually, or sometimes you see people try to pull it out and they just do a little bit of like this even. You see how here would almost be the same as the heel hook because my knee is pinned by the floor. And that's another one that I would say is real common. Knees unfortunately in jiu-jitsu seem to be the biggest one, and some of that is with the leg locks, obviously the heel hook and stuff is dangerous, but a lot of the guard passing and stuff is people just not maybe paying attention to what their body's capable of. So you're more worried about passing the guard and you don't realize that knees don't twist certain ways. But I don't know if it's possible to see that on there as well. When you think about it, the knee is bent already, and now you're putting weight against it. You know, it's
Yeah.
almost going to be similar to that.
It looks like still, if you can get to the point, so, trying to get this kind of motion with the knee,
Yeah.
which is not going to like in either direction, but especially
Yes.
this way, with the tib, fib, internally rotating, because you're putting stress on the ACL there. But if you can get to the point where you can get things back in line so you have this motion available, as opposed to this being the only thing you have, getting your body so you have that available again is probably the position you're trying to get to without thinking of that as you're doing it. But
And we talked, I think, we were talking about that toe hold too, which we can show as well. And the same idea, and it's legal to go one direction with that, but not the other direction. And thinking about this, it's almost like that because my foot is trapped this way, and my knee is twisting this way. That would be, right, internal rotation? So imagine like this is here, and then my knee is going this way. So when you think about it, it's going to be the same as that inverted heel hook, pretty much. It's going to be, which is again why ACL injuries will happen with that.
why it should definitely happen.
Yeah. So with the toe hold, can I borrow you for that one? The toe hold is this is legal in federation tournaments of brown and black belt, and some other tournaments purple belt. But we usually use federation rules to train because that's the most. Is they'll grab the toes here, and they'll try to figure four. So it's like that figure four grip that we always use, and then you can see you're trying to basically put the heel or the toes towards the butt, and bend. Now again, with this one, this is the legal variation. It's not legal to go this way because then there's no rotation in the knee or the hip, and so but that's that same kind of thing. That rotation against that is obviously the dangerous one. Which again, with that's not legal most places that I know of.
Right.
And then the heel hook being the variation again, that
total-
inverted or reverse heel.
You're probably going a little more after the ankle itself in that one.
That one definitely the ankle's going to go first, right? Like it is, and usually it's not a knee thing because you're not doing it from a position where the knee is necessarily totally isolated.
And that's the classic ankle sprain too.
Yeah, just a twist there.
Let's just talk about the two other types of submissions that you can't do until you're a brown or black belt, which would also be the knee bar
Yep.
and the calf crush.
Yeah. So the knee bar, which we demonstrate in fundamentals, you learn it in fundamentals as a self-defense technique, which is definitely a good one, is the hyperextension of the knee. So it's imagine the arm bar, but now we're going against the knee. So with something like maybe here, where I'm using the body to bring the knee to me. So I'm using my hips to push the knee that way. So that one in general, I mean, you can go with what you think would go first on that one. I always tell the people when I'm teaching them, like, if you have tight hamstrings, you're going to know right away. Because it's stretching the legs straight. But if you don't, that's probably even more risk of injury because knees don't bend backwards.
No, I mean you get into PCL, and that's probably where you're looking at meniscus stuff, like you're going to hyperextend. ACLs don't like to be hyperextended either. It probably depend a little bit on where you catch them. Are you getting more of your fulcrum?
It's usually right below.
Hips
Yeah,
below.
yeah. So like the hips, up below, yeah, on the femur, on the femur. Above the knee.
So you're probably, ACL is meant to stop shin from going forward. So ACL is meant to stop this. So if you look and do this, you can see ACL is getting stretched like crazy. So if you are here and blocking and you're taking this knee forward, one of the things it wants to do is go forward like that. So you are stretching ACL there too. And the whole knee is surrounded by a capsule, like a shrink wrap capsule. Mess with a capsule can be really, really painful. So if you get this going on and you're stretching that capsule back here, that's enough to send the alarm through people's head that it's time to stop before something happens to their knee.
Yeah.
PCL's back there too.
I mean, I think the big reason for the rule, a lot of people are just like, oh, I want to work that stuff as good as like, that's a surgery. Usually, the ACL and stuff, and especially if it's a surgical surgery stuff. But also, I think the fact that, like, if you have a knee bar done to you, it doesn't feel like much in if you don't really think about it, or you try to go the wrong way, and that's the thing is a lot of people like they take that heel hook. If you spin the wrong direction to get out, or I put that other one on you and you try to defend, that's it. You make one movement, it's gone. You're gonna do it to yourself.
And at lower level stuff, like the fundamental stuff, I always don't have great balance, and sometimes I fall an extra foot.
Right.
An extra foot means you break somebody's arm.
Right, absolutely, right.
And I'm just saying, there's a bit of a clutch still in this stuff, so I'm not very good at it yet. I can see why you don't teach that.
Yeah, I think sometimes people think, and maybe I am a little bit more conservative. I never used to be, because we used to have a lot of MMA fighters, and you could do whatever, and that was kind of the goal. And the problem is with that is there's no longevity in that.
Yeah. Oh, no.
You take one good injury and you're done, and that does a disservice to the sport, because the sport itself is amazing.
Yeah.
But if you get hurt, The last one, what's that?
Calf crush.
Calf crush. This is the good. You want to do it to me, don't you? You sure? This is kind of This is kind of your thing. So this calf crush is the other one where maybe I'm trying to get out of the knee or the heel hook, or in that situation where I do the same thing. Now, when I turn, what she's gonna do is put this behind, right?
Yep.
So now you're putting tension on all of them. Sit up like this, so now she's starting to put pressure against the back. And you know what I mean?
Yeah.
That's actually, and they also do one on the bicep called bicep crush, which is the same exact thing. So it'd be like maybe knee, like you're doing like this, ankle here, and now putting the compression of my hips. Right, it's all on the bicep tendons.
So
But it will also cause eventually a dislocation.
You're just creating that big fulcrum here that's creating so much space. And once again, if you can look inside the knee and see what it's doing to ACL in there.
Yeah.
And there's not as much twist on that one, but still, it's going to create it's probably going to feel like your patellar tendon wants to rupture too. So that's.
It's interesting because looking at this and talking about this stuff we're talking makes you realize how many things could go wrong with your knee.
Well, especially with knees, they're kind of a shitty joint too.
I always say that.
They only really go one direction, and then if you start losing your meniscus, these little discs inside, it makes bending and straightening to be a little tougher. If you have mismatched quads, and one of your quads is your lateral quad's a little stronger, you're going to have patellar tendon issues. So it's just not a great joint.
No,
it goes one direction for the most part, and there's just little ligaments holding it. It's not like a hip. A hip is a great ball and socket joint ability, but knees get hurt like crazy.
Yeah. One other one I think, if we can address upper body stuff, is shoulders. Or I would say knees and shoulders. If you were to ask me off the bat, like, hey, what gets beat up in jiu-jitsu? Knees and shoulders. And I think shoulders the big one that you see is a lot of people either falling on them or just getting them kind of mashed into the mat. And it's probably a lot of, some, SI probably.
The AC
Not
joint?
SI, I mean,
AC joint?
Yeah, I think because
AC.
people sometimes get swept, and instead of rotating so that they land back here.
Do you get a lot of broken collarbones or no?
No.
Not as many as you would think.
More
You know what I mean?
separated AC joint instead.
Separated AC joint is probably, that's what I
More
was
more
saying.
common.
Yeah, that's, the AC joint injury is a real common injury from what I've seen. Just somebody, you go to fall and you try not to, so,
You land here instead of rotating yourself to land here.
It's like bikers everywhere.
Yeah, we don't have, I know you don't have an upper body thing, but maybe you can explain it too.
It's your collarbone meets this goofy part of your shoulder blade, and it's pretty thick ligaments, and it's often people debate whether your collarbone's supposed to break first or whether your AC joint's supposed to separate first. It's about 50-50. Usually, like I said, bike accidents, and people are crashing their bikes like crazy right now because everybody's out. So a lot of both of those right now, but between that and hopefully you aren't seeing rotator cuff tears, falls like that. But the good news is you can usually rehab around it, work on scap positioning and things to still operate with it and still grapple with it. Bad news is they don't really heal, and once you tear the ligament, it's still you get that little step off here where you can see that the collarbone sticking up. It's going to stay like that forever. And there are going to be some things like reaching across your body that aren't as good. But if you can get positioning improved so that you're not someone that walks around with your shoulder blades up and forward shoulder posture, you can usually improve that a little bit. But it's really, it's a fragile part of your body, and something's meant to break rather than smashing brachial plexus and doing things like that on the nerves on your neck. So yeah, it's a fragile spot.
Yeah, that seems to be the one upper body one. And I mean, people get, you get some shoulder or rotator cuff injuries if people don't tap. Most of the upper body injuries that you see is from people not tapping or falling because they either reach when they're newer and they don't know how to do it yet, or at a high level you see it sometimes because guys are that. They'll take that versus, I've seen that at black belt worlds a few times where guys are trying not to get swept or get taken down and dislocate an elbow.
It races.
Yeah, so that was a couple of years ago. I swear that was a super common injury, and I have no idea why. I'd never seen as many as I did, but there was I think just people being ultra competitive, and I know a few different guys that did it.
And you tell us in fundamentals class, don't catch yourself like that.
The problem is that at a newer level, a lot of times people also, I think, feel like this. So, like we talk about it in the lesson where we do that belt sweep, and I said, don't put the guy here hard because people do this anyways, but they think that they're okay, and they don't realize that it's not just your weight you're holding; it's somebody else's weight and force that's coming down, and all it takes is that arm to go backwards. We're lucky. I mean, you've been through that program a little bit now, so you kind of get it. It's a pretty safe program, which is nice. It's a good way to start jiu-jitsu because it's important. Because just like any other sport, there's a risk of injury.
Well, and one of the first things you do in the individual lesson is teach how to fall.
Yeah, super important.
And I said, my 11-year-old just broke his arm because he had a bike accident. He didn't fall. He tried to catch himself like that. And that's one of the lessons. Just go with it and kind of roll through it.
I don't know, judo coach fall off a ladder. It was like 12-foot fall probably, but just naturally, like falling for 20 years that way.
Got up and started.
And it was all right. Yeah, I went to the hospital just to get checked out, make sure, and they're like, "You're good." And he's like, "All right," But falling, especially 6 months sometimes out of the year, we have massive ice and everything else. It's just a common thing. And so, learning how to fall, that's great self-defense all around. Whether you ever get attacked or not, that's
there's one thing we were doing arm bars.
yeah.
There's someone talked about a hitchhike. You hitchhike out of it. Can you see what that looks like?
Yeah, mostly shoulder rotation on that. So the interesting thing about the arm bar escape, right? It can't happen. It's one of the reasons that you want to control the wrist is it's the rotation of the elbow, right? That's going to give you a lot of the. So imagine she's here and she's getting a normal arm bar, right? She does this, or if you guys were here for the Cobreña seminar, he talked about giving the handshake. So he'll grip it, he'll pull that elbow to his side. And this is the key right here, because I can't rotate my thumb. The reason that we always call it the hitchhiker is because if I can go like this. And so what you're usually going to see as people are doing this is probably good for anybody that knows this technique as to why, is we're going to be here. So people got their hands gripped, right? Or right away, like the person went and they start to fall back and you're able to correct. But once it's straight, you can't do it. So once we're here, I'm not going to try to hitchhike anymore because it's too late. Here, a lot of times they're pulling, right? So they go to stretch, and what you'll see is people will go boom. And so when you go like this here, you're going to also start to turn. So if you notice, I'm rotating. I'm going to rotate through the shoulder, right?
Got it.
And that's what's going to be able to get me out. So it's very much a timing thing. It is. It's usually best on that defense, like a clasped hands defense, because when they go to pull hard too, that's the other thing. They're going to pull, and when you throw and commit, you'll move their body as well, so that they can't go that way. So if you think about when I'm here, if I can put her body this direction, so she's pulling, and I'm kind of like boom, right? She can't take my arm that way against the elbow. So I'm here, right? And then you'll walk, and get out there. Or maybe back roll and get out. But, their goal is to take that and pull it. that
To
direction.
make it all elbow. Your idea is to make it a little elbow and mostly shoulder. Because you have all this.
Yes, yeah, elbow first just to here, right? But then the shoulder is really, and I think that's probably the people that struggle with it the most. Do you want to try it once?
Sure.
Why don't you do it? Do it, and she'll do the arm bar. And just go real slow. You're going to notice that it feels real weird to go away from your arm in this situation. So normal arm bar first, so don't try to do anything. She's going to try to correct your arm. That's where you want to tip. So now when you think about it, right here, what you would do is you're going to put your thumb right. Now just start to turn. Yeah, that way. Walk. Now you can see like almost extend through your arm there, so that you have to rotate through that shoulder. It feels very awkward. You're walking away from that
It
arm.
doesn't feel dangerous.
No.
It's just, it's funny because you first want to go this way. Yeah. Everybody does. And it's like you're here and you're like, I just said arm is right here. You want to defend it. And so you have to go away from the arm. It's very strange.
Yeah.
Like, yeah. But yeah, you can see you can create, and that would be interesting then too, what we talked about, you know, it's not here even. It's like we're doing this, and now all of a sudden we're getting our arm out and straight where it's safer than being here. Because you can imagine you're here, and even if you try to walk away from it, here, right? But if you get here, you can use that shoulder a little bit more. Kind of goes back to your Americana double a little bit, right? So that's really interesting too. It'd be cool if, man, we could have a whole day with just those things. You know what I mean? Like
Elbow,
just,
hip, knee.
yeah, it's so neat because it's like you do this stuff and it's you don't get to see a knee like that, so you don't understand the manipulations going on. You don't understand what you're trying to do. And I think for some people, especially in the beginning, most people are pretty smart now, but in the beginning, sometimes people are just, it's almost like they don't believe submissions work. Every once in a while, you get a guy that gets hurt, and he's like, oh, I didn't tap fast enough. It's like, yeah, this stuff works, like, there's a reason that you have to tap, and, but when you get to see it on a skeletal level with the ligaments and stuff, that's really neat.
Well, they talk in PT school. You talk about end feel a lot. So with every joint, you try to feel. The elbow, it's bony end feel.
Yeah.
And that in an arm bar, you feel bony end feel.
Yeah.
The shoulders, it's it's usually soft capsular, sometimes muscle. Every once in a while, it's bad bone on bone, but it's a totally different feel at the end of the joint.
Yeah.
And that's where with the arm, bony end feel, you're probably trying to break it.
Yeah.
And with the shoulder, it's just the capsular end feel, you're trying to more dislocate it.
Yeah.
So it's just funny that with the jiu-jitsu stuff, going back to labs, you're actually feeling what the end of the joint feels like, and based on that, what you're trying to do.
Anybody throw any questions out at all? Or?
We answered one in the process of all this, but
Okay, good.
another one that just came up was, once you've had bursitis in your knee, are you more susceptible to it in the future? And thoughts on knee pads, good for healing period or for useful for prevention?
Probably a little more likely to get it again. It might just be because that's if you spend a lot of time on your knee for your job or your sport, probably a little more likely to get it. Doesn't guarantee you're going to get it again. And then for sure, knee pads to start. And even if you, sometimes people's pants even bother it. And if you wear some kind of knee sleeve that's got the knee removed, the little hole for your knee, that can in the short term help it a lot.
I mean, like you said, for your job too. I mean, I know guys that work in construction and stuff, and I'm like, that's one of those things where if they're down hammering on stuff and they're doing stuff, like I would most definitely, for jiu-jitsu, it can kind of be a double-edged sword because sometimes the knee pad is restrictive in your movements, and so it can be frustrating to work with something that's big and bulky too. But we touched on it the other day. I mean, we should also try to adjust our training style accordingly. I think if it's me as a jiu-jitsu coach, not as a physical therapist, I would say if your knee's bothering you, see Jeff for physical therapy, but then we should address maybe why what you're doing up here that's doing it as well, right? Because if he's fixing you and you're just coming back up here and doing the same thing, sometimes with a knee, whether it's you're passing a certain way, putting your knees down, you're just spending more time on your knees than, and I talked about that a few weeks ago. I think when I first started too, a lot of our jiu-jitsu was very much on our knees, and nowadays we're on our toes and our feet a lot more. And so if it's knee impact, wrestling was the other one. I said if we're doing a lot of wrestling, and maybe some days it's good to wear knee pads for that, but also trying to respect your body. You know,
I know from fundamentals class too. I have one kind of bad, one decent. I end up doing things a lot one-sided. So if we're going to supposed to do 7 minutes to work on something, I'll do 90% of it one way. And so it could be that if you're training and the one knee is bugging you, that maybe you're going a little bit too much one-sided, and give you a chance to work on the other side.
Yeah, it's tough. I know because like if you wrestle one-sided, you wrestle one-sided. It's like, but you know, look, none of us are. We want to train tomorrow and the day after that, and so there's always a constant correction. We talk about it all the time in our jiu-jitsu from the 20 years ago that we started till now. It's totally different. A lot of the time, it's adjustments because my body does something different, or I've had an injury that I just have to respect and I have to change, or sometimes it's just learning a better way, and then you gotta make that change. You just gotta do it. If you're like, even if it's just that, if you just all of a sudden your knees bothering you on one side, maybe we try the other side. Maybe we try a different idea altogether. Maybe you're too reliant on one thing that's causing that repetitive. Because really, like bursitis, tendonitis, a lot of that stuff is repetitive motion stuff. It's like using something too much, and so maybe we need to change what we do.
That was the one other question we got. The other one we got was, what are the most common injuries you think for jiu-jitsu? We kind of touched on that as we started.
Yeah, man, knees and shoulders, I would say. And I don't know if that's. I mean, there's tons of small joint stuff. Fingers, toes, all that stuff. We beat those up all the time. But knees.
Yeah, most of these broken toes. You can't
Broken toes.
You turn and your toe
Zoom in on this, right? Like
doesn't, or it gets caught on someone's pants. Fingers getting dislocated, toes getting dislocated.
Fingers and toes. A lot of times guys will wrap their finger, especially in the pants, they'll get their finger gripped up really well, and then all of a sudden somebody will kick or move, and it'll just, and it's par for the course. You can't avoid that. That's kind of on you too, but it's real common. Ribs, another one.
People
Yeah,
kind
that
of
would be a
try
real
to
interesting
turn their way.
And that's exactly what it is. It's usually a lot of times, like I'm trying to go this way, and you pull my leg or something, and it's core twisting. And I would say that actually is, that's good that you brought that up.
My guess will obliques probably that too.
Yeah. That popped rib or separated rib, that's a pretty, I have one. I know a lot of people that have one. A lot of times you'll see the guys come in and they're strapping on that girdle, the elastic girdle, but it helps a lot when you have it happen. That first couple of days, it's hard to breathe and get breathe. Yeah, it's pretty awful. But yeah, that's another one just because of so much twisting through our core, and sometimes doing it unguarded. When you're not training those muscles to fire. Do you think something like that is because it happens a lot? But would you say that a lot of the times that stuff can be caused by maybe even muscular imbalance?
I would say obliques. In baseball, you see people are so one-sided that the oblique strain in pitchers and hitters, and especially when something happens unplanned. Like it's usually when they get fooled on a curveball off speed. So all of a sudden they're doing something, they have to adjust real fast. And if you're rolling with somebody, you can't totally anticipate what they're going to do. So all of a sudden you're at a big stretch and trying to hold something, and something changes. So I would say obliques would be the thing that probably would add to that. So and sometimes pulled ribs, can be either also pulled obliques or maybe an oblique itself. But also train it. You can train that stuff decently. You can't train. It's a little harder to train when you're at max effort and there's a surprise or perturbation. But rotation.
Well, we kind of were talking about last week, like prehab, and that's.
I think people don't always think about what imbalances can come from training jiu-jitsu, and something like obliques are a good example of playing something like if you're a guard player and half guard, and and this is the way I play.
Yeah.
People don't realize, but
It's on.
my obliques on this side.
Do an hour and a half, 2 hours. Oh God, yeah. And I mean, you've probably seen it, and we've joked about it sometimes. I mean, even like cashiers at checkout places that are doing this all day, right? Or batting is another one. I know sad. Batters in baseball. I mean, just all,
Swinging one direction.
And what would you recommend for that in particular? I mean, is that something where? I mean, I obviously, we're a big believer in strength training. And, that kind of stuff. But as far as, knowing that jiu-jitsu is very much a core-oriented sport.
Like in general, people don't train rotation. It's easy to squat, and bench, and the straight ahead stuff. But getting into transfers, playing the rotation stuff, it's really, really trainable.
Yeah.
And the power seems so applicable to jiu-jitsu and grappling. And it's funny, if you get really good at that rotational power, the straight ahead stuff doesn't translate quite as well to the rotational stuff. So it's really important to throw rotational stuff into your training things and make sure you hit both sides. Like it's becoming really, really popular in baseball with velocity training type stuff. If someone's a right-handed batter, a big part of the training is you take overweight, underweight, and same weight bats, and you swing your dominant side. You do the same number of swings as your non-dominant side as far as you can go because your body needs to be able to slow itself down the other direction. So keeping it balanced is becoming a really oftenly prescribed thing. Yeah, rotation needs to be trained.
Yeah.
Free motion pieces are great for that.
Yeah.
That we have here because it lets you do a lot of that rotational.
The dumbbell ball stuff's great. Any kind of
I was going to say Russian twist
Yeah.
or the wall ball,
ball's
side
great,
wall ball,
yeah.
like this. Yeah.
in both rotation
All
and
stuff.
anti-rotation too. To launch the dumbbell ball to catch it and not let it take you back. Is
Yeah.
an important thing too because you're fighting rotation so much.
Man, I always think something like that for grappling would be outstanding. Because when something's really coming at you, you'll be able to kind of engage those muscles and fire right away.
We did get a request. Can you recommend any exercises for hip mobility?
Yeah. Even as we sit here, one, I would Google or YouTube FRC hip mobility, but they're going to call it 90-90. But just lining up with femur and tib here. So you're kind of like running man here. And then for this hip, try to extend and push up. Try to get that opened up. And then you're going to go this way. And then to get internal rotation, you're going to come back this direction. It's not going to feel great through here, but we're trying to stretch the capsule out, and this is one way to get that going. And then after you get this side for about 30 seconds to a minute, then you switch back over and do the same on the other side. One, you extend here, and then you kind of reach back this way to get internal rotation of this ball. So that's an easy one to do as part of a warm-up if you're on a mat. And you'll start feeling yourself getting a little bit more motion. If you have access to big bands, just went through this with somebody here a little bit ago, but getting on all fours and having bands pulling both to the outside and backwards. So you've got the big giant bands anchored, and they're just pulling and trying to loosen up the ball in the socket. But the big band mobilizations are a good thing to do. Child's pose is a good one if you can get here and your knees out and rock back into child's pose. That's not a bad one. Really got to ask, is it hip joint mobility or is it muscular tightness? We were talking about psoas a lot before. TFL, the muscle underneath the T-bands, the big one, piriformis back here can limit a lot of stuff. So your classic, half knee hip flexor stretches. So if you're here and you tuck your butt under and rock forward a bit, that's going to get the psoas. You can go into pigeon stretch. There's some sort of version of it for piriformis. So you're getting across here. TFL is really hard to stretch, but you can do having a lacrosse ball handy to self-soft tissue to TFL, which is just this kind of corner muscle right here, and piriformis. Great thing to have at home. So if you can just hammer away at that with the soft tissue work, is a good thing for that too. So right, so broad-based one is your joint, in which case the 90-90 one's not a bad way to get both external and then internal. Or is it muscular where you want to start stretching things out or doing soft tissue things?
That leads to the next question that we got. Can you recommend any equipment for recovery? I've gotten relief from right and tennis balls.
For hips in general?
That one is just its own standalone question.
I gotta be honest with you, the bands from the Village, the big bands, So I'm always carrying the voodoo band around. Whether in, I want to say shoulders, knee, and ankles. So this is just, this is rock floss, but Rogue sells their own brand of it. And it works a couple ways. The first one they call pain gating. Pain and pressure travel the same routes to the brain back and forth. So if you have a painful joint, let's say it's not injured, but it's arthritic or it's still painful following an injury, if you can wrap it tight and put pressure on the joint and do movement, the pressure cars fill up the highway and the pain cars can't get through. So it lets you get through warm up or get through maybe even some of your exercises and your sets without pain. So all you do is you wrap it tight and go through the same movements you would go through normally, and it sounds funny, but it's almost like magic. It makes your joint hurt less than you do things. So if I was going to get one thing, like one toy to use as a rehab thing for shoulders and elbows and knees and ankles, I would probably get some walk floss or voodoo band because it's cheap. It's 10 to 15 bucks or 16 bucks. It can be used for a whole bunch of things. It can be used to warm things up. It can be used to pain gate. It can be used to floss strained muscles and pissed off tendons. So that would be one that would hit a lot of things.
Yeah.
Mark said you use it as
I use that on my hamstring. I tore my hamstring 2 days before the Chicago Open a few years ago. Was still able to compete, not well, but well enough.
And for bigger muscle groups, we sell that one, but we also have the 4-inch. That's the 2-inch. We have the 4-inch wide. It's good for
Yeah,
hips
big
and
ones,
stuff. The big 4-inch wide.
Even the upper quad, maybe with some. Yeah.
The big mobility bands are kind of nice too for the hip. We talked about hip mobilizations, couldn't really show it, but hip mobilizations for getting the one you'll see me doing that post-operatively, if people are lacking meniscus, if you're going to bend your knee, tib is supposed to slide backwards a bit as you go. If you lose part of your meniscus, it gets harder for tibia to slide backwards. So what happens is when people try to bend their knee and squat down, they get kind of stuck. So they get stuck here, and you get a big pinching back. So we'll do something where the band is anchored over here, and it's pulling hard at the top of the tib, and it's kind of helping that motion out. So, using bands to help joints get the motions that maybe they're lacking because there's an injury is not a bad thing to do. So people use that for shoulder things too, like people who have bad impingement, and shoulders are stuck either forward or up, and you can kind of move them that way too. So I would say, the rock floss voodoo band is the easiest thing to get with the big mobility bands. Rogue sells them.
Yep.
You guess so.
Yeah, we sell the rock floss ones.
So those are awfully handy too.
We sell different bands.
That's what we got for questions so far.
Well, we won't take too much more of your time. I'm going to say this, guys. I've had a couple things that have definitely been plaguing me, and this is not a sales pitch. This is
Let's go back so we can see.
just a testimonial as to I've gotten a lot of relief from the stuff that Jeff's been doing with myself, and I think it's super important for us to keep up on that stuff as we continue to train as athletes. We're going to have injuries. We're going to have things that are. It's good to get ahead of it. Yeah.
We got one last question that just came in. Would the rotation exercises, examples being wall balls, help with back pain?
Eventually, yes. It's what I guess would be. It's kind of an individual thing. Does it hurt to do them now? If it does, they might want to focus on like straight ahead stuff.
Glute activation.
Glute
Yeah.
activation is huge in jiu-jitsu because our glutes get so lazy
Yeah.
because we're in forward position so much.
Yeah. So working between glute and just like anterior core type stuff would probably be the first step. Eventually, for sure. I think eventually being strong in all three planes. So straight ahead, side to side, and rotational. Eventually, you have to be strong in all those, and that'll in the long run make back pain better. But it might take the base of getting glutes going and getting anterior core going first before you get to rotation. So maybe.
All right.
That was it.
That's all we got.
Anyways, just continue. Go ahead.
I was gonna add to what you were saying if you were done.
No, I did. You take it away. I said what I said.
No, what I was gonna say is that as you get older, the prehab stuff is so important, and I think one of the worst things people is put off getting help, and by help I don't necessarily mean going to the doctor. You know, some people are too quick to run to the doctor because something hurts. When I think, for me personally, my number one go-to is alternative stuff like PT. You know, Jeff's going to be able to take a look and tell you if you need to see a doctor or if there's something that physical therapy could help. Because most of the time you're going to wait a week to see a doctor, if not longer. You're going to go to the doctor, they're going to refer you to PT, and then you're going to wait weeks and weeks and weeks to get in for PT. So there's something to be said for taking, 15 minutes to come see Jeff and let him do an assessment and see, get ahead of it. Got to get ahead of it.
What's that?
Massage, and don't forget massage therapy too. Because people don't do that.
I think so much can be fixed with physical therapy, massage therapy, exercise,
Like
correctional
strength
exercises,
training.
strength training, versus just, medicating, operating.
If you want to act like an athlete, you need to act like an athlete. You know what I mean? And if you're going to come up here and try to, especially for people that want to be more competitive with their jiu-jitsu, I mean, you need to take all that stuff into consideration. You're going to need a physical therapist. You're going to need massage therapy. You're going to need, good nutrition. You're going to need good strength training, and that's, to the people that want to reach a higher level, that's going to be super important. The only other thing I was going to say is just, Jeff's here on Mondays right now, and as we start opening back up and getting back into things, guys, he did some athletic testing before with some of the guys, and we'd like to do some more of that. But he's going to be, he's going to be here and available, and we want to make sure that you guys are utilizing him when you can. So if you have not seen Jeff at all yet, he will do a consultation with you, 15 minutes, right?
Yep.
And then you can schedule with him. If you need to schedule, you can contact us and we can put you on the schedule. Right now it's just Mondays from 10 to 2, but you need to be on the schedule to see him. And then, hopefully as we get back and get open, we'll be able to expand upon that. I think he's going to be a real valuable addition to everything we have to offer in this gym, so I'm glad to have him here.
If you haven't checked this gym out, at least get online. But we open back up. You got to get in here and check the place out. It's not like anything else you've seen.
Appreciate it. Thanks for being here, man. That was awesome. Super informative stuff. So thanks, guys. See you guys soon.